and we will bring you 2020 Olympics. Welcome, and I give you the news in details. The government of Uganda has negotiated a 3-year financial and economic program with IMF of 722 million to support the country in the monetary, economic and financial policies to maintain a strong economy. The Minister of Finance and Economic Development, Kissa, will cover the period of 2021 to 2024, starting with US $258 million usable for the budget.
The Executive Board of the IMF on 28 June 2021 approved a 3-year financing package under the Extended Credit Facility for Uganda equivalent to $1 billion to support the post-COVID-19 recovery. According to the Deputy Governor, Bank of Uganda, Michael Atinji-Ego, the funds are meant to support government policy and structural reforms to generate additional resources to support the COVID-19.
Money is only contributing to supporting those policies and structural reforms to enhance the recovery.
Finance Minister Matia Kasaija said it was inevitable for government to request for the assistance for economic stimulus. Uganda's economy suffered both external and domestic, with an economic growth decline from 6.8% in the financial year 2018-2019 to 3.0% in financial year 2019-2020.
In this regard, Government of Uganda requested International Monetary Fund assistance to support our emergency response to the COVID-19 pandemic, as well as to support economic recovery in the short, medium, and long term.
However, Matia is optimistic that government will focus on debt sustainability while increasing social spending, including vaccines.
These funds will support Uganda to deal with the COVID-19 pandemic and our strategy of inclusive growth, employment creation, and wealth creation, as stipulated in NP3.
Vaccines. He appealed to all accounting officers of government to utilize all public funds at their disposal efficiently and transparently to drive growth and provide services to the people of Uganda. I
will not hesitate to institute disciplinary measures on any accounting officer who fails to provide accountability or execute timely government projects and programs.
The program will include reforms to increase domestic revenues, foster public sector efficiency, and strengthen governance while preparing the ground for sound management of oil revenues. The Minister for ICT, Kissa Bbuzi, has backed the decision to borrow from IMF of supporting the budget.
Basically, the money is to support the general economy, like to increase the capacity of raising domestic revenues, to strengthen governance issues, to strengthen public sector performance, and generally to stimulate the economy so that even when we have these shocks from COVID-19, the economy can remain strong and resilient.
Jane Nyiramgisha, Ivan Juko, UBC News.
The Director of Crime Intelligence has reinforced its operations to handle adverse effects of lockdown, especially sexual and domestic violence. 200 detectives have been recruited to support the investigations, which are likely to be intense based on increasing complaints. Here are the details.
The 2020 police crime report indicates an increase in the rate of sexual and domestic violence by 14%. This is much attributed to the lockdown, which was instituted to curb the spread of COVID-19 and domestic violence. The Directorate of Crime Intelligence has reinforced its investigation operations to match the demand for justice with the 200 detectives as new recruits.
We have not closed as police, and as a department we are monitoring the desks across the country to make sure that wherever cases have been reported, they are given due attention and responded to, and services are given to the complainants. We have 2 desks. One is handling cases of sexual nature and children offenses. Then another desk is specifically handling cases of human trafficking. And all those desks are working hand in hand and we are making sure that we monitor and supervise what they are doing in the district.
The 2 operational vehicles and 20 motorcycles have been dispatched.
These are 2 double cabins, and they are going to help us to be able to monitor and see whether our officers are able to respond to cases of human trafficking and sexual nature.
Reckless parents accused of escalating domestic violence, and closure of schools is responsible for the increasing cases of defilement. The Directorate has established a special temporary accommodation for the victims.
We have also a temporary shelter here at CID headquarters. And this temporary shelter, because most NGOs who provide shelter services have closed, for us we are operational, and we provide temporary services in case people have issues to do with domestic at home. We can easily pick them and give them accommodation.
Which is responsible with the drug abuse. Investigators have established an increase in the usage of depressants due to the stress, poverty, unemployment being driven by the current state of lockdown.
And narcotics, as you are well aware that they are medicines, most of them are stress relievers. When they use stress relievers, they intend to use them overdose, and that's why we are here. So as for us, we know use of cannabis is illegal. If you are got in possession or usage of narcotic drugs, you are imprisoned for 10 years.
The Department of Land Protection is also reinforcing the standing directive of the IGP, which suspends any kind of eviction during.
Be reminded that no evictions and land grabbing related activities shall be entertained in your.
The COVID-19 second phase mass vaccination exercise in and around Kampala has today registered a low turn-up, which many have said it was due to heavy rainfall and the lockdown that has made many people not to attend. Some people have attended and have been vaccinated in their second jab. Saddam Mubale gave us more details.
The Ugandan government is aiming to vaccinate many Ugandans above 18, but first priority is given to frontline health and social care workers, teachers, security personnel, the elderly, among others, for a maximum of 8 weeks so that they have the greatest protection as soon as possible.
The target groups we are targeting this vaccination is second dose, those ones who got the first dose and they're supposed to get their second dose. That's priority number 1. The second priority is the elderly, that is from 50 years and above. Then also the health workers who missed the first dose with the first bunch, they are getting their first, we can be able to give today. Then also other people like others who have comorbidities like pressure, diabetes, cancer, and other, those ones can be given first dose. But priority number 1 is second dose. So the people who got the first dose to get their second dose vaccine.
There may be some variations depending on where you live and the supply available in your area. According to research, medical practitioners here, having the second dose is essential to ensure the best effect of the vaccine and in particular to maximize protection against the variants.
We started this vaccination on Monday and this is the 3rd day in this vaccination. And we have been able to get a good turn up for the first 2 days because we have been able to vaccinate 273 clients at this vaccination center, and people are positive about taking the second jab.
While it's important to get your second dose in Kampala, today the turn-up was too low, and according to Eriko Mukwana, the medical team leader at the KCCA vaccination center in Nakawa division, associated the low turn-up to the lockdown and the bad morning weather conditions.
Yes, the lockdown might be affecting the movement of people because most of them might be walking, they are supposed to walk or cycle, they opted to do it maybe the next day when the environment is favorable for them.
But those who managed to make it to the vaccination had their message relayed about the second received jab of AstraZeneca vaccines.
My name is Wafula Nathan, and I've come here to get my second jab of the COVID-19 vaccine. I got the first one when I was still at the university. They were immunizing university students at Mulago Referral Hospital, so I went there for the first one. But due to the lockdown and I've been at home, that place has been kind of far, so I came to the nearer post here at Nakawa KCCA division offices to get my second jab.
I've been able to take my second jab and I feel glad about it. I actually feel safe, and I think anyone out there who still has reservations about this jab, I think should think twice and come for it, because so please, for your own safety, for my own safety, for the safety of the people around you, please take the jab.
Sadam Mubale, UBC News, Kampala.
The Mayor Kawempe Division Emmanuel Serunjoji, together with other leaders of the division, have expressed their concerns on the brutal actions by KCCA enforcement teams and security operatives during the Tuesday operation towards street vendors and hawkers in Kawempe Division. The operation in question was conducted under the orders of Kampala RCC Hadi Hussein. As Deborah Namamonde reports, the local leaders of Kawempe want all the merchandise that were confiscated from the vendors to be returned to the owners immediately.
This is how the situation was towards the street vendors, hawkers in areas of Kawempe Division on Tuesday evening during the operation conducted by KCCA enforcement team and security operators. According to eyewitnesses, the operation was conducted on orders of the Kampala RCC Hadi Hussein, which involved confiscation of vendors' merchandise, accompanied with heavy beatings and gunshots. Following these ugly scenes, Emmanuel Serunjoji, Kawempe Division Mayor, with other leaders in Kawempe Division, have condemned these acts towards hawkers and vendors who are affected with the partial lockdown.
We must streamline and organize every worker, including street vendors, hawkers, and other informal workers, to work and enjoy living in Kawempe Division instead of harassing and exploiting them. The city brings
the way they do. You will learn that some of them are being attacked deliberately to provoke them.
Serunjoji also accused the KCCA enforcement team for operating without any law permitting them to conduct the enforcement, thus infringing on the rights of vendors and hawkers and other Ugandans working within the city.
So well as the KCC leadership acknowledges the plight of these people, it's yet to pass the KCCA regulation of street trade. The leadership delay continues to expose ordinary citizens and other Ugandans that carry out trade in Kawempe Division to illegal and unprofessional law enforcers without any redress.
Kawempe leaders also put the blame on Kampala RCC Hadi Hussein for leaving vendors and hawkers to suffer at the hands of KCCA enforcement team under his orders.
He was once a deputy RCC here. He's even yet to give us a report of how all donations and funds were given out.
I'm not sure if that money was supposed to come to us as the task force. But they mounted pressure on me to ask the Minister of KCCA to give us a share of that money. And I wrote a letter, but I didn't receive any reply. And he's aware. But now he's saying, RCC, we want accountability of the 2 billion. We wanted accountability of 20 million for the MPs. Really?
Following this, Kawempe leaders now want all the merchandise which were confiscated
for Kawempe to appreciate the situation people are thriving through and desist the brutal actions.
Omuntu tebalina buyinza kubajjako bintu byabwe. Balina okubaddiza ebintu byabwe.
This was communicated during a presser at Kawempe Division offices in Kampala. However, talking to Kampala RCC, Hudu Hussein condemned the acts by law enforcers and asked Ugandans not to provoke them.
But I don't encourage any police officer to beat up any Ugandan. I am sure the directives can be implemented without causing chaos, without really beating our people.
Bonde, Ubc News.
Danger in Gulu district and the city have both run out of COVID-19 vaccines. The 1,290 doses allocated have been used up due to high demand in the 5 vaccination sites. According to Sister Anena Grace, the Assistant District Health Officer, another 1,500 doses are needed to complete the vaccination of people seeking for the second jab of AstraZeneca vaccines. Here are the details.
Due to a high demand of AstraZeneca vaccines in Gulu district and city, all the vaccination sites have run dry.
Generally, the vaccine has already been used and we don't have any stock now in the DVS and even in the 5 sites of Gulu district sites that have been designed for the vaccination of COVID-19.
Sister Anena Grace, the Assistant District Health Commissioner, says some people had to go back without vaccination as an extra and needed to complete all the people who already received their first jab.
It's really like 1,500 doses because half of the
priority is being given to health workers and teachers. However, at Gulu Regional Referral Hospital, many elderly people also turned up for their jabs. At Anywe Health Center 3, people reported as early as 7 a.m.
Surprise, the vaccine went off in the middle. And we were just sorry for the majority who went back without the vaccine.
52-year-old Omona William believes that the local councils should sensitize people to embrace the vaccine.
The local councils should sensitize people so that they know the benefit of this vaccine.
The turn-up from both gender is estimated at 50-50. Evelyn Akidi says she had to overcome her cowardice to take the jab.
At the beginning, but I saw people are getting and they're coming back. I see no complication with them. They're doing their work normally as usual. So that one triggered me up to come and also get it.
No serious side effects have yet been reported.
So I'm hoping for the second dose as well because I'm still feeling good. There is no pain, no any reaction.
Despite the high demand for the vaccines, the health workers are calling on the government to honor their promised allowances and personal protective equipment.
They should think twice because we are the frontliners. We don't have enough protective gears and motivation not there.
The COVID-19 vaccination in Gulu is conducted at Gulu Regional Referral Hospital, St. Joseph's Hospital Lake, Anywe Health Center 3, Patiko Health Center 3, and Awach Health Center 3. 1,190 doses were delivered for the second phase of the Oxford AstraZeneca vaccine for both the district and city.
A section of people who turned up for their second jab vaccination of COVID-19 at Kasese Municipal Health Center 3 have missed out due to less doses of vaccines in the facility. Details follow.
According to the health workers in charge of the second phase of the COVID-19 AstraZeneca vaccination exercise, the overwhelming number of people that had turned up for the second jab to complete the COVID-19 immunization went back without being vaccinated due to the less doses that were dispatched to the district by the National Medication at Kasese Municipal Health Center 3 said it was not easy for them to control the anger for those who missed the second dose.
The other group was very, very annoyed that they reached an extent almost of beating we health workers, and we had no option because we had no way. Then another challenge was the cards they brought were very few, and those who didn't get were really shouting at us, they want their card, they want their what, and we had no answer for them.
She said that after realizing that people were many who had come to receive the vaccine, they switched to selecting the most categories of people and those that had cards indicating that they had received
their days of return. So getting these people from us was that we decided to select the people who came first in March, who got their first jab in March, so that at least we control the line. But all the same, those who got in March were many. We couldn't control.
Kagenda Bwebare Robert, who had received his second jab, expressed concern over less doses compared to the number of people who had turned up to be vaccinated.
The jab is very fine. We have no problem with it. I've not seen any side effect since the first jab, and this is the second jab. And I hope it is a normal, like any other immunization we have been using, taking our own children to be immunized.
Baluku Pitaras
is the one that is going to save us if we are to live. But if we don't go for vaccination, then we shall be having some problems.
The former FDC president, Dr. Kissa Bbuzi, wants Parliament to take the lead in the fight against COVID-19 pandemic. Addressing a press conference in Kampala, Dr. Bbuzi expressed satisfaction over which the government intends to distribute relief aid to the most hit by COVID-19 lockdown. Bbuzi believes that members of Parliament should be in the lead to help this. Here is the detail.
That's the plan that I talked about, plan of monitoring. It's not there. That, there is monitoring in the districts at these levels, in the health centers, that you are monitoring this. There is no plan. So they only test those who are sick, those who are in trucks, those who are traveling abroad, those who are going to visit Mr. Museveni. So, and this is where the country should worry. Today there is technology, even to test yourself at home. One doesn't even need to go to hospital. There is technology to test. Antigen test, not the PCR identifies the virus itself. But the antigen test identifies that your body has had the virus. And there are simple tests to do that. In Europe and other places, you just go to the pharmacy. They are free. Any pharmacy, they test you. But here there is not. So the testing is not happening.
The absence of personal protective equipment at Lila COVID-19 treatment center has started causing fears among the frontline health workers. Apparently, the treatment center is running without N95 masks, which are necessary gears required to handle COVID-19 patients. The head of COVID-19 task force in Lila has also said that they are working on the clock to ensure that all these are replaced. Let's get more on this.
Lira Regional Referral Hospital is the only treatment center serving all the 9 districts in Lamu sub-region. The center is currently managing 20 COVID-19 patients, with 11 critically ill, while 8 are on oxygen. However, the center is currently threatened by lack of PPE.
Have it completely. So that is the biggest challenge we have with that facility. Otherwise, they are doing their best to save lives.
Lawrence Igoli, the head of COVID-19 task force in Lira City, applauded the health workers in the facility for saving many lives, registering more recoveries than deaths.
I'm grateful to the Ministry of Health because of late we got some more supply of cylinders and the regulators. So now people forget that these cylinders are needed only for COVID patients, but there are those who need it. They have always been there. We need them in the male ward, in the female ward, name them. There are so many.
In the third consignment of vaccines recently distributed, Lira received 1,500 doses, with the priority being given to those taking the second jab.
We shall also consider.
The jobs have been distributed to different facilities in the city and the district in order to decongest the vaccination sites.
It happens that there are children, more children here.
PAG Mission Health Center, that was recently upgraded to a general hospital, is one of the facilities to carry out vaccination in the city.
At first we got the priority, the target population were not so much responding, but of recent they responded. And as we are all aware, there was a span of time where we didn't have vaccines, but yesterday we received the vaccine. The district health office has also trained additional team that should be able, from tomorrow or Thursday, we should be able to start off vaccination immediately, following strictly the guidelines that will come from the district health office.
Dickens Ogwal, the medical superintendent of PAG Hospital, said the facility is committed to triaging all patients that visit the facility.
So right from the gate, as you saw, we are able to take the temperature. If the temperature is suspiciously high, we have a particular place, we don't mix them.
Those who got their first job and waiting for the second had this to say.
And I was encouraging people who are fearing to get this vaccination. It is easy.
So if you're a mother out there, I also want to encourage you that we want you to be alive because you carry life actually.
With the 2 deaths registered in the last 2 days from COVID-19 in Lira, authorities still continue to urge all members of the public to adhere to the presidential directives issued on the 18th of June in order to curb the spread of COVID-19. Eddie Olwa, the UBC News.
We are coming to you live from Kampala. This is UBC and on with our news. But now we're on for a break, and after the break, my colleague Jordan will join you in with our guest who is going to discuss matters.
Fellow taxpayers, ladies and gentlemen, my name is Joseph O. Okuja, and I am a tax consultant and a tax agent practicing under the brand name Libra Advocates and Consultants. I come to you as a messenger to preach the good news of voluntary tax compliance. This is probably not the time to be talking tax compliance, considering that we are in the middle of a pandemic and a countrywide lockdown. And I'm sure many of you are asking the question, whether to file or not to file, whether to pay or not to pay. Many taxpayers are in a dilemma since government imposed an abrupt lockdown on the country, and as a consequence, many businesses and some businesses effectively have no source of income. Some need for social distancing and self-isolation during this period is gravely affecting the ability of taxpayers to meet their tax compliance deadlines, in spite of the fully digitalized tax filing and tax payment system that was introduced by URA. However, our government needs the tax revenues to continue providing public goods and services, and therefore individuals and businesses are still required to meet their tax obligations to the government by promptly filing and paying any due taxes to URA. While I sympathize with the many affected taxpayers, I invite all taxpayers to be diligent and proactive in the management of their tax affairs, businesses and transactions, and ensure that they are tax compliant at all times. The good news is that URA has cleared some tax agents to continue assisting taxpayers in complying with their tax obligations. It is therefore very important that as a taxpayer, you always seek professional assistance, especially at a time like this. The more advice you obtain from tax professionals, the better informed your decisions will be. There are various mechanisms under the tax law that you can take advantage of and indeed remain tax compliant. But above all, you need to file your tax returns and endeavor to make payments to the greatest extent possible. Tax compliance is fully automated, and a tax return can be filed from the comfort of your home. Similarly, tax payments can be made through any of the electronic payment platforms. I wish you all good health and blessings in all your undertakings as we strive to stay alive. Please file your tax returns by the due dates.
Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Central Points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates. from 1st May 2021. Everywhere you go. MTN.
COVID-19 chijja kugwa. If we get vaccinated now, observe social distancing, wear a mask properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
Uganda has the best and most affordable rates when it comes to withdrawing and sending money. Withdraw money for as low as 330 shillings up to a maximum of 12,500 shillings. Sending money is just as affordable as ever. Absolutely unbeatable. Use Airtel Money on the most affordable network with the largest network of Airtel Money branches in Uganda. Dial *185# to get started. Airtel Money. Simple, secure, borderless.
Yes, a very good evening to you tuned into UBC TV. Thank you so much for following our programs and the news. And my name is Michael Jordan Lokoma, coming in with a brief interview about the situation that is putting all of us on tension. That is about nothing else but the pandemic, COVID-19. We're losing lives, we're losing everything. Work is at a halt in almost every sector. But what exactly is going on and how do we handle? We're going to focus mainly on the education sector, where schools have been closed almost for 2 years. Even when we tried to open, the pandemic got serious and we had to close again. So with me is the new minister, State Minister for Primary Education, and that is Dr. Joyce Moriku Kaduchu, former Minister for Primary Education. So if anyone is very good for this discussion, Dr. Kaduchu is the one. Doctor, you're most welcome to the show.
Thank you so much. Good evening, viewers. It's my great pleasure to be here today to discuss about the pandemic, and I'm sure that with the background where I came from and where I am, I should be in position to give a comprehensive discussion for our viewers.
We don't have the suspect, but the criminal herself.
That is very true.
Okay, how is the education sector as we start with schools closed and what we're doing?
I first of all want to make
One would think you're not busy at all.
I first want to make this very clear. We all know that measures has been one of the best measures to reduce the spread of coronavirus strategy that has been employed globally. Uganda is not exceptional. And of course, schools in Uganda were temporarily closed in an attempt to reduce the spread of coronavirus.
Yes.
We all know that that was done in the interest of our learners. It was done in the interest of parents and the entire country.
Sure.
Because life takes first priority compared to the situation where they came from.
That is
Having
this year
said
and
that,
even now.
yes, and we all know that education is a powerful tool, and it has laid a solid foundation for socioeconomic transformation and overall economic development in any nation.
Yes, Doctor.
And we also know that education is the main driver of moving people away from poverty by increasing livelihood. And because of that, even in Uganda, Vision 2020 made it very clear, and it gave a lot of highlights on the role of education in terms of improving economic development in the country. Now, following the lockdown, the best really, and we must salute the head of state, we must appreciate the head of state for having immediately
put a strategy in place to close the schools and send the learners home. We all knew what took place. And of course, COVID has posed a lot of challenges in education sector. Challenges because when the lockdown came in place, over 15 million children are at home. And it came with a lot of challenges. Then there's a lot of loss of time for learning. It has come with affected the standard of learning. And of course, the instructors, the teachers, and the lecturers are equally affected. And because of this, without formal education, when these children are at home, our own learners and the children, they become susceptible to many environmental risk factors.
Are the challenges that
the
come?
challenges that come with these children when they're at home. You can talk about, some of them have outgrown their classes.
If not all of them.
Absolutely. You get issues of early marriages, teenage pregnancies, domestic violence, sexual violence, child abuse, child labor, and many, many other environmental risk factors.
As they are at home,
Absolutely.
what are you doing as the ministry?
Now, the point comes.
Yes.
We need a sustainable solution, which as government we've put in place.
What
a
is
solution that can really help this, the period that the learners are at home. And I must make this clear. Education is a shared responsibility.
True.
When it is a shared responsibility, we must involve all stakeholders. Stakeholders that plays role in the education and the learning of a child. And I'm talking about sustainable solutions that are home-driven, sustainable solutions or interventions that are put in place by institutions and government. First and foremost, when we talk about home-driven sustainable solution, we are speaking about our own parents taking full charge, including you and me.
Definitely.
We need to act. We need to stop this business of lamentation day and night. We need to take full charge and be responsible.
At that very point, Doctor,
I give
just something small. What does the parent have to do and how? We are talking about a parent who is worried about rent, worried about what, some have loans and what. Again, these children at home, they need food and all that. How do you expect a parent?
Yes, of course.
What do you think they have to be doing at home?
We can take
in supporting the children?
We can take advantage of these challenges and turn it to an opportunity.
How?
And we take opportunity because much as the schools were there, sometimes the parents do not have this opportunity to be with the children close to close and all through. And this is an opportunity for us as parents, first of all, to be with our parents, to sit down the children, to give, very importantly, value-driven moral values. Moral-driven values for our children. Because we are talking about the parents are looking for something to eat, the parents are doing ABCD. But this is the time that we can involve our children fully. If it means programming our children, time for reading, time for work, for maybe digging, and time for doing other household work. This is the time to train the child to get to know our children personally. And this is the time to pray with our children as well. Because sometimes we do not have that ample time. Because if we do not know, we do not get our children better. And of course, I talk about the home-driven sustainable solution. There are quite a number of solutions that we can take advantage about it. Because if we rely on the challenges, not turning the challenges and tapping opportunity, tapping it to become an opportunity that we can, our children can benefit from that, then we miss it all.
Okay.
Number two, I talk about the institutional sustainable solution. And of course, as we all know, government of Uganda has put in place measures in place. Immediately when the children are at home, interventions that is to help our learners. A case in point, for example, we have the distant learning with appropriate technology.
Doctor, I want us to go there later on. Let's start with this one. We had reports that during the first lockdown, when we had the first problem of the COVID-19, when we got opportunities of schools being opened in bits, there were cases of COVID-19, children that were tested positive, but schools kept silent on that issue. How much have you done as government to go about this issue? In case we are to open later on, how much have you prepared to curb such problems? And what reports are there about these schools? And the children, by the way, that later were released from school, are there measures of following them up? How are they? Have they transmitted this problem, the disease within the communities where they went? How much are you doing as Ministry of Education, Health, and government in general?
Of course, what happened was very unfortunate. We all know that standard operating procedures were put in place for schools to follow. We all know that school administrators are to ensure that standards are adhered to. Standards are put in place where the learners are sleeping, where they are eating, where they are learning. If that standards are not followed, the school becomes a potential media for infection transmission. Because you see how the children sit in class. Of course, if you don't make them sit and leave a distance between one another, if you don't give a space in the dormitory, you don't give a space wherever they eat, that is a very potential place for transmission of the virus.
So that happened when we opened?
That was a big mistake, probably. The school administrators have really not taken the standard seriously, and because of that, many children have got the virus and the transmission became obvious in schools.
Have you followed them
Having learned that from schools,
yes,
in the next phase, as we enter probably, if in any event we are soon going to open the schools, we are going to put more stringent measures, and this time round it's going to be very strict. Strict in the sense that if you do not adhere to the set standard, we do not want to compromise the lives of our children just because you want the school to run on. Life is more precious. So if you do not adhere and you are not ready to adhere to those set standards, the schools will not open.
Doctor, that will be very good. But as per now, according to the information that we have received from you, the experts and authorities, is that this virus grows within 2 weeks. We have had, this is the second week of this second lockdown. So these children were sent home and they are making the second week. And we're going to hear cases within the communities where these children went. More worrying, we saw them in the taxi park going up country where the problems were not that vibrant. So are we not having a problem looming in the villages and up country communities?
And of course,
because if you're reporting as government that actually there were cases in the schools, these cases were definitely sent home.
That is very true.
Exactly.
And I want to tell you,
how are you following up on these cases?
By the time these children were sent at home, I want to believe that probably some of them are at a later stage of that infection. Some of them might be at an earlier stage. Some of them might just be at the beginning, others probably might be at the stage of treatment. We heard that some children are kept in isolation places and being treated. So that means the time they went home, you've had the last 2 weeks, really the infection rates in the communities were very high. And of course, this is very true that their presence, those who came back with infections, might have transmitted the infections in the community, in their homes, in their villages, in their home states. It's a high possibility. But eventually, as the 2 weeks gets over, probably we will be seeing the infection rate coming down.
But do you have some ears on the ground in the communities where the children went? What kind of information are you gathering?
But certainly information Ministry of Health is gathering, and they are really following these cases up. Okay. And because of that, right from the system set in the district, the district has got the task force. Okay. The district has got the village health task force up to the district task force. And of course, the flow information from down up has been moving. And this has been brought forward to the Ministry of Health. Okay. So I want to believe that, yes, the learners have got COVID. The parents, I want to thank them. For those who came with the virus, they were able to treat and manage. For those who were negative, they were able to keep them free of virus. But my emphasis as of now is the children, our learners. My request to the parents is we must still keep them out of this problem. And of course, I cannot say that
what other things do you think parents should do to keep children safe?
And that's where I am coming, that the children need to be kept busy, they need to be kept interactive. We as ministry have, of course, we've talked about the distant learning with appropriate technologies, the use of the radio messages, the television, the internet Zoom with other higher learning institutions, and also materials that have been sent to the district for the young, the primary students, that they should get busy, and the parents, that's why we talk about the enabling environment so that the children are able to read at home. So the children should be kept busy. And as a ministry, we are already preparing ICT policy in education that is in pipeline.
Before you go beyond that, Doctor, the online teaching, you talked about Zoom, and actually you have hinted at the plan to come up with the ICT policy in the ministry. How effective is the online teaching so far in our institutions that was introduced as we went during the first lockdown? How effective, what results did it yield so far? Before we
I think really it has been effective in the sense that you saw the outcome when the students were at home. The senior 4s had not sat for their examination. The primary 7 had not sat for the examination. You recall the first ones, and many of these institutions of higher learning had not done examination. But that period when they were at home, using these technologies for learning, when they went back home, the various candidate classes sat for the examination. And of course, the outcome shows clearly that we are coping up with this new technology. We are coping up and try our best to use and make the children benefit from that, from university.
What is your view about the complaints among the communities?
Of course, the communities complain come there. Also, sometimes some homes may not have the radio, but the materials have been sent for those who are not able to access this information through radios.
Really?
And I must say that, yes, we may not be perfect as of now, but we are striving every now and then, every day. We are trying our best to improve this learning technology for our learners.
Doctor, when you say the system is not yet perfect in that line of technology, facilitating education, what are the gaps and where do you have challenges?
And that is why the ICT...
how are you solving?
The gap is in the internet. That is true. Sometimes it's not very stable. And I must believe that your own ministry, the Ministry of ICT, working together with the Ministry of Education, put in place policy. But in the meantime, as we work through the approval process of this policy, we have in place digital agenda for strategic, that is already put in place. The strategic plan has been approved. It is going to be unveiled, and it is going to work in a comprehensive systemic manner that is going to involve all the sectors and bring on board all the sectors. And we believe that is going to help improve the learning process, that is the distance learning process.
In this situation?
Yes.
We will have just 2 minutes to leave this set, but there are things I don't want us to leave here having not talked about. There was a plan to bail out teachers, those in government schools and those in the private sector. Is there any success so far? If not yet, how far have we gone? What is the plan like?
Absolutely. Because of this lockdown, especially the private school teachers are not able to access salaries. They are not able to get the benefits that they've been getting when the schools were running. Now, government has come up to put in place how best we can support these teachers in primary schools and those who are in government schools but not on payroll. So already the responsible ministry is working that out together with our ministry to ensure that we support these teachers. But of course you cannot give an entire comprehensive support, but we are also encouraging our teachers to try as much as possible to do other means that can generate income for the family, because of farming is where everybody is. If you have the land, if you have access to go to that farming or other means of getting income. Otherwise, government is going to support the private teachers.
The plan is still there.
The plan is still there.
Okay, let us wind up with this one.
Yes.
We already have information that there are over 5 variants of COVID-19 in Uganda. First of all, I want to talk about vaccination briefly before we go. How effective is the vaccination process with the new variants that are coming up? By the time these vaccines were produced, COVID had just come into existence, but it has had variants that have come up. Are the vaccines still effective on the new variants that that we are receiving every other day? Uganda alone has 5 due to the information that we've gathered.
Yes, that is true.
How effective is the vaccination with the variants that are coming up? Is it
I want to pass this message for our learners and our teachers and also for other Ugandans. At this point in time, we are having variants, yes. Let's avoid panic. Let's avoid excessive fear. Let's avoid uncertainty. The best is to put on hammer and the tool that can enable us to fight this virus, and that is one, the positive attitude towards fighting this infection. Number 2, what we need to do and to know is that the ultimate solution to this problem is having community immunity, population immunity. That means we need to be vaccinated. If we get a huge proportion of the population is vaccinated, meaning that 60% to 70%, that will provide indirect protection to those who are unvaccinated, meaning that very good number of people should be vaccinated. Now, the vaccines that have been given currently, they are really offering protection against the first variant. That's true, the Chinese, but to some extent, it has been proven scientifically. It also offered protection against this other variant. And I want to conclude by this. Yes, we all know for the learners, they do a lot of reading, they do a lot of exploitation, but they should understand that they can fight this infection. Why? Because when you get the virus, when you inhale the virus, the first option is, of course, prevention by doing the SOPs, observing SOPs. In the absence, if you fail to observe the SOPs and you inhale the virus multiply in the nasal cavity, in the upper airway, and in the process of attacking our cells, the epithelial cells, and there's going to be immune reaction, meaning that our antibody is going to fight off the virus. When your immunity is strong at this stage, you will fight off this virus. This is the time when you get sore throat, you cannot smell well, you cannot taste well, you have maybe fever, you have body pain, you have headache. Go and test. We have the antigen antibody testing, whatever reagent. Rapid test. If you cannot test, this is the time you start actively, take responsibility of your body, fight the virus. Should not progress up to your lung, meaning that you can be active by doing exercising. You need a balanced diet with lots of fruit and remedy that you're taking so that your body, your immunity can fight off the virus. But in the absence of that, if the virus defeats and gets to the lungs, that is where it is going to cause havoc. Just like getting enemies here and our askaris, our soldiers fighting. In the process, they destroy the buildings, they destroy glass. Virus, our reaction, body reaction to the virus in the lungs, destroy the lungs, the small air space, the alveoli, which enables gaseous exchange, gets destroyed. You are not able to breathe in and out. In that event, you need oxygen. This is the time I'm telling our learners, I'm telling the people of Uganda, God has given us the oxygen. Let's try the natural oxygen. Before we get to the level that we need oxygen, let's try as much as possible and take full charge and fight this before our lungs are destroyed and we get to the oxygen. And we can't do that when we get the right attitude, we have the right attitude to them. Stop panic, we avoid excessive fear, and we accept the situation, especially when you get a person who is positive in your community. Okay. On the whole,
thank you so much, Doctor. We thank you so much for the time and all that we have shared. To you watching, information is always here for you to share, but as well take good use of it. This is Dr. Joyce Moriku Kaduchu. Is just immediate former State Minister for Primary Health Care. We were so much with her in the runarounds to do with COVID-19, but she is now State Minister for Primary Education. We still have to ask her a lot of questions because education is one of those sectors that have been hit hard by this pandemic. So this is not the only time we'll have her here. We have shared a lot. Thank you so much for watching. My name is Michael Jordan Lukomwa. Enjoy the rest of the evening. Bye-bye. Doctor, thank you for coming.
Thank you.
Yeah.
Thank you.
Also have enough air to...
It is intellectually engaging.
And you can only become a leader when there are problems. I like that.
The same applies to Rwanda, Burundi. So what are we federating?
Whether rats from another country can be, I mean, somebody must be there to hold everybody accountable.
But at the moment, we would rather deal with what we have, make it right.
First of all, we as elites of Uganda, we have made Museveni the issue. I can tell Museveni is not the problem of Uganda. The problems of Uganda are much deeper. We can change the next 20 presidents and we'll still be this roundabout.
Deeply incisive.
The different political forces that we have in the country, we don't seem to really have achieved that minimum political consensus over certain things.
Authentically symbolic and insightful. Behind the headlines every Wednesday at 10 p.m. with Charles Odongto.
Very welcome.
Probably the most experienced talk show moderator in Uganda, with a team of illustrious panelists. Honorable Abdul Katuntu, a seasoned legislator, politician, and senior lawyer.
The worst that can happen to any society is to have a press which is ignorant.
Honorable Margaret Mohanga, a veteran journalist, legislator, entrepreneur, and development consultant. And Ramadan Gobi, an economist and university don.
Only audit institutions, effective budget tracking, e-government, and curbing illicit financial flow. They are the only...
Inspiring Uganda.
And now I think that it doesn't matter what kind of passport you have, you can travel. So
what we have seen over the last few days is an increase in the number of incidents that have taken place inside the ultra-Jewish religious neighborhoods.
Город оказался парализован, покойников было некому хоронить, трупы лежали на улицах.
Он трижды обращался в государственную клинику, но из-за большого потока пациентов его не смогли принять.
We have a lot of privatizing politics, taking public resources to help private enterprise. So now that we have this coronavirus menace, we have not a very strong public system to affront it.
The first countries to face the pandemic have been the first to ease the lockdown. Having quarantined the fridge for disturbing my work, I made a call to Italy. Italians have spent 19% more on food during the lockdown than at the same time last year. Unfortunately, this has been the only positive development for the economy. Italy was the first European country to undergo lockdown, though it may be lifted shortly. Many enterprises will open for business again, but masks and gloves